Excellent, very good.
Welcome to the RedMed podcast, Rescue, Expedition and Disaster Medicine, where we provide a platform for healthcare professionals working in or aspiring to join rescue, expedition and disaster response teams. A platform to share information, advice and opportunities and connect like-minded RedMed individuals in our community.
Good afternoon everyone and welcome to episode 9 of the RedMed podcast. As usual, I'm joined by our SS crew chief Chris Sharp. Good afternoon, sir.
Good afternoon.
This podcast, as usual, is supported by SOS Coffee, Guatemalan coffee we sell to use to run medical missions in underserved communities around Guatemala and to deliver free CPR and bleeding control courses. Sadly, today I'm not drinking SOS Coffee, we're in Starbucks.
Well, outside of Starbucks.
It's chucking it down with rain. Following on from the last few podcasts, we've received a lot of interest from medics out in urban areas wanting more information on courses and career paths and how to get into the RedMed sphere, if you like. So we thought I'd delve into the types of courses and progression and sources of information that might help medics get into this environment, into the rescue, expedition and disaster environment. The first thing required to get snapped up, accepted and be capable of supporting a Red team really is having a well-rounded and relevant CV or well-rounded portfolio. Not just hospital, not just pre-hospital ambulance, but well-rounded, including some of the topics that are going to be relevant to the particular job that you're deploying on, whether it be expedition, rescue or disaster. But I think, Chris, the most important is having a baseline healthcare professional qualification, whether that be EMT, paramedic, nurse, doctor, and registered with the appropriate authority or governing body. That way, anybody hiring or firing can ensure your legal status, you comply with the minimum requirements, they can do due diligence on your criminal background check, etc., etc. So it doesn't matter where you are at this stage, you may not have done any wilderness courses or rescue disaster courses. The key is having a good, solid platform, which is your healthcare professional qualification, right?
Yep.
A couple of good things to bolt on prior to deploying anywhere or going into a disaster environment or an expedition, working on an oil rig, a tactical team. A couple of good courses for anybody would be the ACLS, Advanced Cardiac Life Support course, and the Pre-Hospital Trauma Life Support. That gives you a good, well-rounded, specific and up-to-date idea of the protocols that are going to save lives. Albeit, ACLS on an expedition, you're probably not going to have a monitor. You'd be looking to have a defibrillator, let alone a 12-lead ECG. But they're good baseline courses anyway.
But they give you you understand what's happening with the body. Not necessarily you've got the tools, but you know what's happening with your patient, so you know what needs to come next, what needs to happen, where to take them.
Yeah, exactly. You know where you need to move your patient to and what support they need. So whether you're on an oil rig, a close protection team, a mountain expedition, or maybe a 4x4 overland trip, the issues you'll encounter and the competencies you require can really be split into 4 generic categories. And this is not written in stone, this is just putting some notes together and talking. But 4 categories might include primary care skills, emergency medical care, trauma care, and then specific to role, whether that be overlanding, climbing, ice climbing, you name it. So the skills and knowledge needed to manage each will really depend on the nature of various things. Every trip's going to be different. The nature of the location or the environment you're travelling to. Is it jungle? Is it desert? Arctic? The available equipment. The infrastructure available to you and within the country. Local protocols, legal status, your own guidelines. The number of team members, any medical support that you've got immediately or within the immediate area. And the population diversity. Are you caring for young fit soldiers, or have you got paediatrics within the group, geriatrics, obese,
prosthetic limbs?
Yeah, as you had last week. So I think one of the courses that I've done really served me well in this environment, and that's the UK Health and Safety Executive Offshore Medic course. It's a great bolt-on course for existing healthcare professionals, whether it be army medics, nurses, paramedics, and it provides us with an ideal base to operate in remote locations, originally designed for the offshore oil platform, but it includes trauma care, medical emergencies, ILS, ALS, primary care, particularly useful for paramedics because paramedics generally, mainstream, don't do a lot of primary care, if any, unless you're a community paramedic or an emergency care paramedic. So the health and safety executive offshore medic is a very, very good starting block. We'll talk about that a little bit later on in the podcast. Other courses that you could consider on the medical side might be the NAEMT AMLS course, Advanced Medical Life Support. It's only 16 hours, but the manual is incredibly comprehensive. It's got all sorts from bites and stings, anaphylaxis, cardiac arrhythmias, diabetes. Really great reference tool, but a very good toolkit to use to look at your differential diagnoses when perhaps you're in the middle of nowhere and the signs and symptoms present like 5 or 6 different things. How do you rule it in? How do you rule it out? How do you do your doctor house in the middle of nowhere? So the AMLS course is a fantastic course. ACLS, PALS, Paediatric Advanced Life Support, depending on your population. Neonatal resuscitation, PEP, Paediatric emergencies for the pre-hospital provider. So there's some of the useful medical courses. On the trauma side, I think it's been phased out now, but the ATT course, the Assessment and Treatment of Trauma, I think it's now been superseded by PHTLS. They've been absorbed by Jones and Bartlett. So the pre-hospital trauma life support, civilian version, 16 hours. Great course, absolutely fantastic. More applicable to the US market and protocols and the way of thinking, but it is developing. And the 9th edition, certainly in Spanish, the 9th edition is coming out this year. So it should have some good updates. Then you've got ITLS as well. Very, very similar courses. On the primary care side, obviously if you're a nurse, community nurse, doctor, GP, general practitioner, particularly a military medic, probably got a lot of primary care experience. Paramedics, mainstream, tend not to have primary care experience. But again, the offshore medic course will be fantastic. It's a 4-week course, comprises of 2 weeks on site, covering primary care, a little bit of prolonged field care, trauma, ALS, ITLS, and then you've got 2 weeks clinical attachments. 1 week should be in an emergency environment and the other in a primary care environment, probably shadowing a doctor, doing multitude of patient assessments. But fantastic course to bolt on to an existing qualification. Other sources, more and more, particularly in the US, paramedics are starting to specialise and diversify. We've got tactical paramedics, flight paramedics, and now the new community paramedics that are trying to get in and do more frontline healthcare, health promotion, prevention initiatives. And that's a formal qualification these days, community paramedic. I guess the equivalent in the UK is probably the ECP, emergency care practitioner, which do a lot more minor interventions and primary care, which is worlds apart from the frontline ambulance stuff that we generally do. Then we've got more specific to role courses. There are hundreds. This is just a small list or a small sample of some of the courses that we run, that we've seen, we've used to good effect. And they can be applied to any level, whether you're a doctor, nurse, paramedic, just to kind of translate some of the skills and put them in context in the relevant environment. So you could start off with the ASHE, American Safety and Health Institute, Wilderness First Responder. That's an 80-hour course, or the ASHE Wilderness EMT upgrade. That's a bolt-on for EMTs and paramedics, 40 hours. It's core first aid applied to the relevant environment with a lot of improvisation and a focus on the kind of things you're likely to see in a wilderness or expedition environment. So heat injuries, cold injuries, bites, stings, ticks, fractures, bleeds, evacuation considerations, packaging, all that kind of thing.
And on that, I think even the wilderness first aid, the first responder, although even if you're a doctor, paramedic, critical care nurse, I think there is value because it's putting you in what may be an alien environment. Like when we turn up with a roll of masking tape and a machete, because we know we can fabricate everything in the middle of the jungle, the forest, wherever. So and I know when you ran the AWS course, you've got doctors going, I would do this, this, this. Well, you don't have it anymore.
That's a really good point, actually. The AWS course, which is the next course I was going to talk about, we had probably 10, 11 doctors on the first course, and we're jumping in to the evaluation. Yeah, I would give this, I'd give 50 milligrams stat of that, I'd put them on an IV infusion of that. Well, okay, great ideas, and you're absolutely clinically correct. But we're on the side of a volcano and you've got what's in your pouch on your belt.
Yeah.
We don't have those drugs. What can you do now? And it helps, these courses just help mould your approach, still drawn on that incredible grey matter from your previous training, but just putting it in a context and adapting it.
And the benefit of those courses is what, because if you choose the right provider, they're intensely practical. So you may want to be an expedition medic, but realise you don't actually like it, or you're not fit enough, but it's also a good way to network with the instructors for whichever provider, or like we've had people and then we've used them again in future for smaller operations. It's like a networking tool. It introduces you to a new environment that you might not actually like everybody wants to be helicopter rescue until I stand you on the skid to rappel at 200 metres.
You realise you don't like heights.
Yeah. And it's a good introduction to the actual expedition world, even though it may only be a wilderness first aid course.
Oh, very true, the networking. I did the WMS mountain medicine course and summited Aconcagua with a group of 20 healthcare professionals, and 2 of those ended up coming to Guatemala to help us develop the first AWS course. Fantastic professionals. So that takes us on to the WMS and the University of Utah Advanced Wilderness Life Support course. It gives you 20.5 hours CME or CPD credits. Lasts for 4 years. It's generally run in a classroom environment over 2 days. You can get it into 2 days or a long weekend. The way we've run it, and a lot of other companies run it, is put it into context. Do some of the practical lectures, as you're obliged to do. Do some of the group discussions, and then the demonstrations and the skill stations, the scenario-based exercises, do them in a real-world context. Talk about altitude at altitude. Talk about immersion injuries, head, neck, spinal injuries whilst you're on the river, whilst you're rafting. Talk about snakes and spiders whilst you're in the middle of the jungle, and that's exactly how we've done it in Guatemala through the jungle, and again in Mexico on Pico de Orizaba, more than 5,000 metres. But it's a great course, particularly when it's run in a hybrid format like that. It covers heat, cold, altitude, diving injuries, bleeding, burns, head, ears, eyes, nose, throat issues, bites, stings, ticks, lightning, drowning, water treatment in a remote area. Absolutely fantastic course, and gives you 20 credits towards the fellowship, which we'll talk about in a bit. Some other short bolt-on courses that might help you in certain environments, particularly the disaster. The NAEMT, the new AHDR course, All Hazards Disaster Response course. Very, very short course, 8 hours. It's got a short manual, but it covers key topics: introduction to triage, infectious diseases, CBRN, structural fires, active shooters, motor vehicle accidents, all the kind of things that you're likely to come across on a daily basis, perhaps in a normal pre-hospital environment. But those coming from a hospital environment might not have experienced that. So yeah, any disaster stuff, that gives you a good intro. Then we come on to the PHTLS military version, or the TCCC course, Tactical Combat Casualty Care. There's 2 versions. There's the MP, the medical provider version, for military healthcare providers, military medics, physicians, physicians' assistants, and then the AC, all combatants, which is